Welcome to Clinically Speaking, the podcast where we share unique clinical cases of interest. I'm your host, Gary Nolan, Clinical Programs Manager for X-Ray at GE Healthcare. Today's image comes to us from Dr. Julia Krim, Professor and Chief of MSK Radiology at the University of Utah in Salt Lake City. She also serves as Chief of Orthopaedic Radiology at the University of Utah. The image she sent to us was, at one time, exceptionally rare. This is a frequently misdiagnosed and sometimes undiagnosed injury, a fracture of the lateral process of the talus bone. Prior to the popularity of the sport of snowboarding, you had likely never seen an image like this one. Today, if your practice is close to the ski slopes, or if there are skateboarders practicing their craft nearby, it's likely you'll encounter a patient with this type of injury. The patient presented to the University of Utah Orthopaedic Center for further evaluation of a possible subtaculum tali fracture, partially diagnosed on initial CR images that were taken immediately post-injury at a local hospital. The extent of the fracture of the lateral process was not seen on the initial CR image. The additional DR images were taken at the Orthopaedic Center. Dr. Krim commented on the clarity of the fracture on the DR versus the CR images. Incredible clarity was achieved through DR's custom process settings to highlight trabecular bone and subtle fracture lines. Two fractures were visible, a fracture of the lateral process of the talus and a fracture of the subtaculum tali. CT confirmed the fractures that were discovered via DR images. Had those fractures been missed, healing would have been slow, painful, and resulted in a difficult future. Through surgical intervention, physicians were successful in stabilizing these injuries. I'd like to offer a special thanks to the University of Utah Orthopaedic Center for effectively demonstrating on how digital radiography can help physicians provide a better diagnosis through clearer images, and maybe even get some snowboarders back on the slopes. Remember, if you have an interesting digital exam you'd like to share with your colleagues, contact your GE Healthcare representative. Well, I'll see you next time. I'm Gary Nolan, hoping you'll keep on clinically speaking about digital radiography.